Welcome everybody to our Egoscue Hip webinar. So I'm Laura, and thank you for being here. We've had the opportunity to meet some of you who are here online, and I know some are joining us later on the recording. And I've always been an active person. I love to move, hiking, biking, swimming, walking my dog. I have a 13-year-old golden retriever who's always been active and still loves his walks. And so that's an inspiration for me just to keep going. But there was a time where I had challenge biking and doing my walks because of very severe hip pain that I was able to decode and figure out what was going on to loosen up what was tight and to strengthen what was weak to restore that balance. And I savor the moments now when I can walk with my dog and hike up a mountain and not have that pinching pain. It feels so good. I've been working in the movement space for over 30 years, owned a wellness studio north of Montreal. I'm Canadian, and now own two Egoscue clinics, one that I'm in Cannon Beach today, but also have the Portland clinic. And I think I'm just inspired to be here and to share now the knowledge that I've gathered through my 30-year journey, my degrees in fitness education, with lots of certifications. But I think what's really inspired me and empowered me is the last 20 years of really learning and understanding and applying the Egoscue method. It's something that's really helped me balance my own body, get me out of pain, and so that I can enjoy all the activities that I like to do. So we're here to share that with you today.
Awesome.
Pass it to you, Zach.
Thanks. Yeah. So I've been doing this Egoscue thing for almost 10 years now in Seattle. I opened up the clinic here after actually I started in Portland. The previous owners, Martin and Kelly McFarland, kind of helped me get off get my start. I started as a therapist there. But I originally heard about Egoscue when I was in grad school. Well, undergrad, I guess. I studied exercise sciences. I was, doing some personal training, trying to figure out what I wanted to do career-wise. And I learned about the Egoscue method from a professor of mine who had, chronic back problems until he found this method and it was really helpful for him. Um, it initially it just really made sense to me, this idea of like using our bodies, to heal themselves really through movement and proper alignment and balance and just by doing simple exercises sounded really intriguing to me. And of course, being the 20 something year old I was, I thought, oh, this is great, but it's just for old people, right? Like, this isn't for me. I don't need this. I'm invincible. Well, I got to experience it myself when in grad school I played a lot of racquetball, and then I started developing some shoulder and back pain as a result. And so I thought, well, maybe I should try this myself. And sure enough, I got my posture photos taken and was able to see really clearly how my body was out of balance and out of alignment. And it just made sense. Okay, well, that's why I'm hurting. It's not really the fault of the sport. If I'm bringing a body to the court that's already, compensating and not moving properly, of course it's going to cause issues. So anyway, I started doing the exercises and sure enough felt better and was able to keep playing. And so that's really what motivated me to, I wanted to help other people achieve the same thing. So got certified, um, moved to Portland to work there. And then, like I said, about almost 10 years ago, came to Seattle and been here ever since. So, and it's still something I use. I've in those 10 years, it's not been 100% pain free. I've had my bumps and bruises and injuries, but I've always been able to come back because I have that foundation and treating the cause and not just the symptoms, which is what we're all about here. So that's what we're hoping to share with you today is a little bit of more information about how you can understand your pain and then know what to do about it. So if there's any,
Yeah, Zach, if I could just add to that, thank you for sharing because it's true. We're never 100% pain free when I've shared my story too of having that hip pain. What I like to mention to people, and I hold myself accountable to that, is of all the exercises that we prescribe to people, I'll often say choose your one or two out of that menu of exercises that we prescribe for the individual, what your non-negotiables are. It's kind of like that. Brian, one of our colleagues, says this all the time. When people say, well, how often should I do my exercises? And he says, well, only on the days where you brush your teeth. And so even if you have that just one or two non-negotiable exercise, and I know when I start feeling a little bit twingy in my lower back or my hips, like, oh, I know which one or two exercises that I need to do to get me back into balance before it gets worse. So yeah, thanks for sharing that.
Yep. Yep, for sure. All right. Well, and by the way, again, if you have questions, please put them in the chat, or there'll be time to ask at the end, of course. But feel free to, if something pops up, just we'll be monitoring that. So really appreciate all the feedback we've gotten so far. So, all right, I'm going to share my screen next. Okay, probably want to start at the beginning. Okay, there we go. All right, so we'll start right off. Obviously, uh, everybody's here um, probably because you've had or have currently some kind of pain, right? Um, we're talking about hips today, but really this will apply to any body part. It's the same approach. It's just you know how we look at pain is a little different than I think what you'll find in most of Western medicine, at least, which is we don't see pain as necessarily a bad thing. It's just a signal, right? And so we got to interpret that. So just like when the check engine light comes on in your car, it's a warning. It tells us, oh, something's not working the way it's supposed to, in a simple sense, right? Of course, then we just need to hopefully take it to a mechanic or decode the what the computer's telling us and figure out, okay, why did that light turn on? Doesn't necessarily mean anything's like drastically broken or irreparable. It just means something's not doing what it's supposed to. So now if we ignore that, we just maybe put some duct tape over the light on our dash so we don't see it, right? Try to ignore it. Yeah, it's probably going to turn into something more of a big problem down the road, right? So really, we have to kind of shift our mindset here and think, okay, what is the pain trying to tell me? Let's not just try to shut it off, but really think, okay, why is the pain there? Um, and I think that's kind of the first question. It's a warning, doesn't necessarily mean there's damage. So, and usually that warning signal, unless you hit by a car or something or some accident, usually it's because our bodies are out of balance. Right? Just like this house, obviously not very stable. I'm amazed it's still standing, honestly, right? It's pretty crazy how crooked it is, but our bodies, we see people every day that look kind of like this. Somehow they're still standing, but it probably doesn't feel good. So our bodies are the same way. We need that proper alignment of those load bearing joints, or like the house has the load bearing walls and the foundation, that holds it up. um, our joints, our skeletal system is kind of the same way. So um, when we talk about posture, we're not just talking about, we probably have all been told by maybe our mothers or school teachers or something, oh, sit up straight, pull your shoulders back, and it's not really as simple as that, right? It's a relationship of our whole body, all the joints in our body. That's what we talk about. That's what we mean when we talk about posture. It's more about alignment, which is going to provide that support to all the structures. We focus on the joints and the kind of the muscles and uh, you know musculoskeletal system, but there's other parts of our body that are affected too, which we can talk about later. But digestive system, respiratory system, all that. So good posture is simply a state of balance, meaning our right and left side should be basically doing the same thing. The front and back side of our body should be, those muscles should be in balance to hold us upright, and it's not just when we're standing still, but it's through our whole day. So moving, sitting, walking, squatting, bending over, like those are all movements that require a certain amount of balance and coordination with our muscles. So we look at posture, generally we measure it or assess it with standing posture, just because that's simple and repeatable, right? But something to think about. So basically, our body's designed to move, right? We think back to when we were younger. Um, we probably all moved more when we were kids than we do now. I think that's a safe bet. um, we were just playing, not we weren't exercising necessarily, right? We were just moving because that's how our bodies are designed to work, right? We were playing, we were jumping, crawling, rolling around, climbing trees, whatever. And so now, as we get older, unfortunately, we have more responsibilities, right? We have to go to work, or we have to drive in a car for a while and be stuck in traffic. Like there's some of our modern lifestyle that doesn't allow a ton of movement, but um, and that's ultimately what we're trying to do with Egoscue is restore some of that healthy movement, kind of to offset the sedentariness. Um, and even if you're a lot of us still like to exercise, or we have our sports that we enjoy still, which is great, but we're probably still not getting enough like full body, like balanced movement, meaning all our joints are, being used the way they're supposed to. So we tend to focus in on, the exercises we like or the sports we like, and we probably are neglecting things, which is what leads to these imbalances in our posture. So ultimately, in correcting the problem, we want to, again, not just eliminate the pain through, some of these ways that just maybe treat the symptoms, and not that they're bad. A lot of people think Egoscue is like anti-surgery, which is not really the case. I think there's cases when surgery is definitely your best option. We don't try to push people one way or the other. We want you to do what's best for you, but I think there can be a lot of surgeries prevented and a lot of unnecessary procedures and drugs taken if we fix the root cause, right? Um, but we could also be like these people on the bottom left, just resting, and that actually does people a lot of good too. It's funny how many clients I see that go on vacation. They tell me, "Oh, it's funny when I was on vacation, I didn't have any pain. As soon as I get back, pain starts again." So there's a certain amount of our lifestyle, but unfortunately, we can't just be on vacation all the time. Or we could just give up the activities we like. I could have just given up racquetball because that's really the only time I hurt. But rather than limiting ourselves, we'd rather fix the root cause so that we don't have those limitations, right? We want to be active our whole lives. We don't want to just keep limiting ourselves, right? So, all right. So let's talk about what posture actually means and what we're looking for. Any questions so far before we go on? Okay. All right, Laura, we want.
Hmm. So this is usually the second person that you'll meet when you come into our clinics, and his name is Freddie. So Function Freddie is our ideal posture. Now, it's very rare that we see any human walking around with perfectly symmetrical posture. But if you look at yourself in the mirror and just get really curious and ask this one question, what is different from right to left? So the 8 load joint design means that we have 2 shoulders, 2 hips, 2 knees, and 2 ankles. So we're examining what's going on in your ankles, what's going on in the knees, what's going on in the hips and the shoulders. So hip pain sometimes can be due to a rotated torso. Sometimes one shoulder is more elevated than the other. So if you look at yourself in the mirror, do you have one hip that sits higher than the other? One that looks to be more rotated, more forward of the other? When you look at your kneecaps, is one patella or one kneecap facing inward or outward, which tell us that your femur position, your upper thigh bone, is rotated and not sitting perfectly balanced or straight in that hip socket, which can cause wear and tear over time, leading to inflammation and then arthrosis and then arthritis, and then sometimes that disc or the degeneration of the joint. And so ideally what we want to do is restore this function so that we have the most symmetry possible between the shoulders, the hips, the knees, and the ankles. And we know that muscles move bones. And we'll get into what actually moves the muscles when we look at that a little bit later. But take a look at your posture and just notice when you're standing, are your feet pointing straight ahead or is one pointing out or in? That's usually a compensation pattern for something that's happening higher up in what we call the kinetic chain, because the ankles and knees, the hips, the shoulders, the spine, everything is connected. So if we manipulate or move one joint, then there's going to be a reaction through the next joint. And it actually moves the bones in certain angles. So when we do our corrective exercises, we're then putting the joints in a certain alignment, ideally in a neutral alignment, so we can retrain your muscles to hold your body in the symmetrical form. We'll go on to that next slide. So if we look at your side angle, and we do this when we take your photos when you come into the clinic, that we will graph your posture and draw these beautiful lines on your body to see where is your alignment. So this one is always an interesting one when we look at your side profile. If you look at yourself sideways in the mirror, are there straight lines from your ear to your shoulder to your hip to your knee, and your knee to your ankle? Sometimes we might see that this body is actually sitting forward of that gravity line. Sometimes it's leaning back, or sometimes it's the hips that are bailed forward. The ear and the ankle might look like they're aligned, but the whole middle part of the body is sitting forward of that line or back, which is putting more strain then on our hip joints as well. So these are different clues and cues that we're looking at when we do the assessment. Ideally, we want to maintain this S curve of the spine, so the curve at the neck area, the cervical area, down to the lumbar spine, which then gives more space for our nerves to pass. And it's the nervous system in our brain that helps fire the muscles correctly. So somebody mentioned in the chat earlier, I feel that I have one leg that's weaker than the other, or I have a tight piriformis. Well, the question is why? And we want to investigate, why is that happening? Why is that muscle tightening up? Is it pulling the spine out of its S curve? The nerves aren't firing correctly. Is there compression there? Or the piriformis? Those are part of the deep hip rotators. We sit on them a lot during the day. They can actually go to sleep. So so if you take a look at this photo here, the first one on the left, these are your we call them the deep six. So your piriformis is that center one that you see on the left that attaches at the head of your femur and goes horizontally across to your sacrum. The sciatic nerve passes from the lumbar spine, comes through. You can see those little holes in your sacrum, passes through the piriformis. So piriformis syndrome sometimes is the nerve compression. You might feel numbness in that hip or down to your leg, or some tingling, or just this nagging kind of a sharp pain, or even just a dull ache that's constantly there. So why is that tight? And there's other muscles. These are horizontal muscles. So unless you play tennis, or like Zach talked about, racquetball, any sports where you're moving side to side, or you're doing exercises where you're moving your legs sideways, these muscles don't often get the kind of activation that they need. And there's a syndrome that's actually called glute amnesia. Our glutes, our deep glutes, which these muscles are, forget their job. They forget what they were designed to do. And then other muscles like your psoas, your deep hip flexor, or other surrounding hip muscles, sometimes TFL, which is a lateral top hip muscle as well, starts to tighten up because it's just doing its job, trying to stabilize the hip joint. But this is why we want to restore balance of these muscles to get them all working synergistically together as a team, so that we can restore that function, so that we feel less discomfort, less pain. So on the right-hand side, these are some of the hip flexor muscles. And when we say hip flexors, there are several. The primary ones that we talk often about are the psoas muscle. The deep psoas is a deep hip flexor. It's the only muscle that attaches the upper body and lower body together. And oftentimes, and Zach and I have talked about this in previous webinars of low back pain, oftentimes that low back pain is actually a hip dysfunction, because if you take a look at the psoas, maybe Zach, you can just move that cursor. He's pointing, it attaches at the lumbar vertebrae. So T12, the 12th thoracic vertebrae, down to L4, L3, L2, L1, all the way down. So if those muscles, because we're sitting a lot during the day, they get short and weak. So we need to be able to get full motion of the hip. And somebody mentioned earlier too that you were doing race walking. So race walking is important to make sure that we get that full motion of full flexion and full extension. But sometimes those tighter muscles or weaker muscles are inhibiting that joint function and not letting us move the way we want to. So these are things that we'll investigate through photos and through functional testing to get to that root cause. Is there anything you want to add there, Zach, on muscles or the
Not just
function, Freddie?
when we look at this, and this isn't a complete like picture. There's a lot of muscles that are kind of not shown in these pictures, but it goes to show
Mm,
just how it's really hard to blame just one muscle on something, right? So because these
mm,
all, just think if all we did was contract this one muscle, the psoas on the right side, what would happen to everything else, right? Well, spine would kind of bend that way, or this hip would lift up, or your leg would go into flexion. That would make the muscles on the other side be in a more lengthened position, right? So it's kind of like a seesaw there. If you push here, the other side's gonna move too. So that's why it's just important in a simple sense. We're just trying to restore that balance, right? We just need the muscles on the right side and the left side to do the same thing. That's what's going to ultimately um, hold our body in this balanced position, is just proper function of all those muscles. So um, we just a little. We're not going to be quizzing you guys on the anatomy or anything,
mm.
but just so we understand, the hip joint is what we're talking about. That's like the ball and socket, like the top of your leg bone, your femur has a kind of that round head that goes into that socket of your pelvis there. And that's where a lot of these problems like arthritis or SI joint, that's if you see the two iliums on either side, and then in the middle, the sacrum. So that's the sacroiliac or the SI joint. So it's what connects those two big bones. There's one on either side. So that's a common place for people to get problems if, again, pelvis is not in a symmetrical position. It's going to put a lot of strain on those joints. Labrums, common problem people will have is a connective tissue that kind of sits inside that socket and kind of encapsulates the ball or the femur head. That can tear or get worn out. That's bursitis is another common thing we see. Burses are just kind of like fluid sacs that kind of protect where there's friction points usually. A common one is on the very side of your hips. Like if you've ever had that pain, like right on the side of kind of where that bony spot on the side of your upper thigh um, can get inflamed again. And we always just have to ask the question, well, why, right? Like people like
Hmm.
age on things, right? Oh, I'm just getting old and that's why I have arthritis. Well, how old's your other hip, right? Why is it not hurting? Same age, same, number of steps you've probably taken with your right leg and your left leg over your life. So why is one side wearing out more? It's
That's
usually,
interesting that Zach, if I can just interject, because Brenda made a comment exactly to your point here. When we're looking at the head of the femur sitting neutral in that hip socket, Brenda said that she has her feet straight when she's standing, but one points out when she walks, and she's got a bone spur in her SI joint. So my mind goes to, if you look at that head of the femur, that means if the foot is turning outwards, it's very likely that that femur is externally rotated. So it's rotated outwardly. When that's externally rotated, it's possible too that that's compressing that SI joint if it's constantly in that position, or tightening those deeper hip rotators that are then, to what you just said, causes that friction. And then that friction can be wearing down some of the cartilage, some of the deeper tissues, and perhaps even causing that bone spur. And why is that? The body sometimes lays down more bone too to stabilize itself. It's looking for some stability. But as we know, that's false stability, right? That ends up in pain. So we want to make sure that we're looking at what's imbalanced right to left, or why is the foot compensating by turning outwards? What's going on in that hip, and what's going on in those deeper muscles, that we can restore that balance through maybe some pelvic driven corrective exercise. So these muscles, and this is, somebody asked me recently, well, how long is it going to take for me to start feeling better? And there's a statistic that says it takes 3,000 to 10,000 repetitions to be able to create a new motor pattern. So we know that muscles move bones. What moves muscles? It's part of the brain, right? So the brain sends signals through the nervous system, through the sensor, through the nerves that innervate or contract and release those muscles. And so we do corrective exercise, putting you in a perfectly as much as we can aligned position, neutral, retrain those muscles to be able to work and fire correctly and activate again in a balanced way 3,000 times. And I calculated this the other day I said, okay, well, this exercise is 3 sets of 15. If you do that every day, 3,000 repetitions would be 66 days. So 66 days to develop that habit and a new pattern. And, when we start to repeat those patterns naturally, even just after one session, Zach, you can probably attest to this. We see people immediately after their first menu not even thinking about it. Now the feet are walking straight. There's less pressure on the hip joint. Oh, wow, look at that hip that was elevated before has now dropped down. There's more symmetry between the right and the left. And that's really empowering, when we feel that for ourselves and we see that in others, that this really gives us hope. And that's so possible that when we retrain those muscles repetitively every single day, just like brushing your teeth, the body has memory. It knows what it's designed to do. We just need to give it those reminders.
Yeah, no, for sure. And we're gonna. Someone asked about are we giving exercises, and yeah, at the towards the end here, we will actually give you guys some example exercises so you can feel just kind of what it's about. And most of you will probably feel some kind of improvement. We'll talk about what we're looking for there, but you should feel some change right away. Now, obviously, we haven't put in those 3,000 reps, but even just doing a few reps will give us a temporary change. It may not be a full rewiring of your brain yet, right? But you should expect to feel some positive effect, like right when you do the exercises, and every time you do them,
Yeah,
your
so
body
true.
a little bit straighter. So this is the part where we get some interaction from you all. Show you a real life example here of a client. This is their first day. This is kind of, we take the photos front and back. Well, we do front, back, and both sides. We're just keeping it simple here. But I want you to look over that and just put in the chat or unmute yourself and chime in. What do you see that's off? Like, go through each joint and just tell me, okay, what's not in the proper position here.
Yep. So Christina said head forward and shoulders rounded. Yes.
Yeah. Or weight on one leg. How do we tell that, Brenda, or anybody?
Hips forward of that gravity line. So is that line lined up what we're looking for? Remember the function, Freddie, lining up with the ear, the shoulder, the center of the hip joint, the knee, and the ankle.
Yes, that red line. Well, it's no, you're right. I mean, it's just that red line is in the middle of between his feet. So ideally, all his those four joints on the right and the left should be stacked so that red line is right in the middle, right?
Yeah. Crossing over his navel, sternum, and nose.
Yeah, but you can see he's kind of off to his left. And so, yeah, we can assume putting more weight on the left side. Yep. Right. What else? How's did anyone mention? Yeah, so from the front, what about his shoulders and his hips? Do they look horizontally level? Oh, there we go. Dorvin caught it. Yeah, good. Right hip elevated. Yep, so we all see that. So you can kind of usually the pants will follow. They'll kind of sit on your pelvis bones, right? So if your one pelvis is higher, usually the belt line will be crooked. Some people notice like I always have to hem one pant leg longer than the other, or your pants don't quite fit the same on both legs, and that's usually because pelvis is off.
hmm And the difference of space between the torso and the arms, even the knuckles, seeing more knuckles. So we see more rounded shoulder on that left, more knuckles than the thumb.
Mm-hmm. Okay, I think yeah,
Good.
we covered the most important stuff. Yeah, this forward hips kind of brings everything else with it. This is why when people complain about neck issues, right, his head is so far forward, it's putting all this strain on his neck. It's not really the neck's fault, right? Like it's kind of the hips fault, right? We got to get his hips back if we want that head to be lined up as well. Does that make sense? So his whole body is involved here, right? All right. All right, there he is. Uh, just a couple short months later, he's put in the reps, right? Um,
Mhm.
what's different now? What changed?
Yeah, I like that his stance even changed, wider foot stance, so that he's got more alignment from his hips, narrow stance versus a more balanced stance, hip, knee, ankle aligned.
Hmm.
That line from the center of his feet coming right up through his nose. That's a even the space between his arms and the torso has balanced.
Yeah, yeah. Shoulders are back. I mean,
Shoulders back farther, yeah, and that in line with the ear.
grew a couple inches, maybe. Yeah, I
Grew
mean,
a couple inches. People often say that I got taller.
or lost weight. Sometimes when your hips are this far forward, I mean, your belly comes with it, right? So you push your hips forward, and it kind of makes your gut stick out farther than it needs to, right? So even if you don't actually lose weight, this I know he has a shirt on, but um, having a better posture just looks better too, right? So it's more flattering. But yeah, head and shoulders are straighter. And since he's now more centered on that red line, we can assume his right and his left leg are doing closer to like 50-50 percent of the work, right? So that's going to be beneficial for our hips, right? And we talked about one side getting worn out more than the other. It's usually because we're using one side more or differently than the other. And so if we're more balanced side to side, always a good thing.
Yeah, that's the stability in the feet. Brenda just said that looks more stable, and people will often say that too. Even when we do the exercises that we'll do together today, you should notice a difference. So we'll do that together. We'll test our feet, our stability, do a few exercises because everything's connected. So whether we work through the shoulders or through the hips, sometimes the hips are too painful to target directly. So we can also work through the upper thoracic spine and the shoulders, and that'll have a positive impact on the pelvis and the hips as well. We'll look at that later.
Yeah.
Okay.
Just want to show another couple other real life examples just so you can see what's possible. These are this lady on the left was a client of mine, and she came in with hip pain. It was actually pretty debilitating when she started. I mean, she couldn't sit for really any length of time, like just driving to Costco, was like a big deal. Like she couldn't do that because sitting was painful. And the crazy thing was she had all the doctors look at her hip and everything, and it looked normal, right? So they were like, well, I don't know, here's some drugs, but you're not really a candidate for hip replacement. But she showed all those same signs, right? The pain in the groin, the pain, the butt pain, difficulty reaching over to put on socks and shoes. Well, when you look at her posture, she's kind of similar to the example we showed earlier, same kind of issues. But for her, mostly it was actually like an upper back problem. So you can see how far, because of this rounding in her upper back, and then the head being so far forward. And then on the right, we see she's made a lot of improvements there. So this was what we discovered for her was everything that we did to improve her upper back just made her hips feel better. So it wasn't really a hip issue. It was her upper body was causing that pain in her hip. So it just kind of shows how it's all connected. And the Pete Egoscue, the founder of the method, always says the site of the pain is rarely the cause of the pain or the source of the pain. So that was definitely the case for her. So then Laura, this was your client, right?
Yeah. So this man came in with what side do you think he had pain on? So he came in with that right hip pain. Look at how much his right foot is turned out. And he always stood that way. And he was just trying to get away from that pain. He'd lean more into the other leg. He is very athletic, plays a lot of sports, but a big surfer. So a lot of rotation in his sport. And you can see even the torso is a little bit rotated. That right arm is forward of the left. There's more space between the arms. So we worked together for the last year, and then a more recent photo there on the right. Now he's reporting zero hip pain. That was like a big celebration because that plagued him for a long time, and he wanted to stay as an active dad and enjoy all his activities of biking and hiking and surfing. Um, and yeah, it's fun. It's an ongoing process. If he lets that go for a few days, sometimes he'll start to feel the hip shift a little bit, but that nagging pain that just never went away is now a thing of the past. So that was kind of a really nice, inspiring story of this person here. And you can see his low joints, so the shoulders, the hips, the knees are more aligned. His stance is more balanced. His feet are straighter. His shoulders are more level. You can see on the first photo that right shoulder is higher than the left shoulder, a little bit more level. You can still see patterns within the body, and we all have our own patterns of possible imbalances. But it's when we can keep that as symmetrical as possible that we start feeling better fairly quickly.
Nice.
Yeah, thanks, Zach.
Okay, here's another kind of extreme example, but I like to show it because it just shows how even in these extreme cases where you look at that lady, on the top and think, wow, like first of all, how'd she get like that? That's her trying to stand up straight, right? And secondly, like, man, I can't imagine how uncomfortable that must be, not just for her back and her hips and her neck. I mean, think about her internal organs, right? Not a whole lot of space there for her digestive system and her lungs to work properly, right? So she's probably suffering a lot. But this was this, and by the way, this is a client from our one of our sister um, clinics in Japan. But this was her after just the first session, so she actually made this progress within just one day. She walked out that much straighter. So it just shows how our bodies can always improve, right? It doesn't matter how far gone we think we are, right? There's always a chance that we can make some improvements. So, all right. All right, I think this is the last. Yeah. So, with hips, especially, anybody who's ever worked out or maybe worked with a trainer or tried to do any kind of fitness stuff, you probably have heard about hip hinging. It's really important with moves like a squat or a deadlift motion. But even just something is so basically the pelvis should, if this is your femur, your thigh bone, right? You've got that socket pelvis sitting on top to bend over. It requires that pelvis to move like this, right? To kind of move over the socket. But you can see in this example, this is how a lot of people, because of those weaknesses and just in lack of use of proper range of motion in the hip joint, we start to lose that ability. So we can't really move the hips. And so then we end up moving mostly from our backs. Our upper back has to do all the work. And then we wonder why we throw out our back when we bend over to pick something up, right? Versus, here after doing a few simple things to kind of re-engage the hips properly, now you can see she's able to touch the floor because she's not bending her back more. She's actually probably bending her back. The line kind of covers it, but her thoracic spine is probably a little straighter. She's getting more range of motion here in the hip socket and lower back. So anyway, it just kind of shows how pivotal our hip function is in everyday tasks, right? So
Yeah, can I add, Zach, just before we stand up and looking to that, because most people right now in this webinar are sitting, and many of us spend a good amount of time during our day sitting. And so, how do we get the pelvis rotating and neutral over top of the hip socket? And our colleague Brian often says, if you're going to sit, then train for the sport of sitting. If you're facing surgery, then train for the sport of surgery, meaning prepare your body for these things so that when you stand up, have you ever stood up after being sitting for an hour or more, and you feel those first couple of steps are hard? You feel like, oh, that's a little bit stiff to stand up. So if you're sitting right now, before we actually stand, take a look at your sitting position. Are you like that first photo where your pelvis, if I go back here, most of us sit in a slouchy position where our pelvis rocks back and then the lower back is rounded and the upper back is rounded, just like you saw in that photo, but I'm in a sitting position. It's the same thing. So notice how you're sitting right now. Are you sitting on your sacrum bone in the center of the back of your pelvis, or are you sitting on your sit bones? So what I invite you to do is take a look at your feet, bring them pointing straight ahead 5 inches apart, and then see if you can roll and rock your pelvis forward, which will get you up on those two sit bones and put that natural S curve or that arch, at least in your lower back. So try that a couple of times. We call that a pelvic tilt. So you're tilting back and then tilting forward. And that in itself can be a good exercise to practice if you haven't done pelvic movement to get the pelvis rocking over the head of the femur. And then when you are sitting up on your sit bones, look at, I didn't change my spinal position, but when my pelvis is way back here, look where my head is and look where my spine is. Does that look straight and aligned? All I'm doing is initiating the movement and manipulating that neutral pelvis, and then look what happens to my spine and my head position. It follows naturally, right? So then notice how you're sitting. Are you sitting evenly on both sit bones? And we're going to do this in a second standing. Do you stand evenly on both feet? Well, most people are leaning more into one butt cheek more than the other, or rocked back more than they're rocked forward. So how we sit, whether it's sitting at a desk at a computer or even just sitting at our dining room table, really plays an important role in our posture and what we do for many hours in the day.
Yeah, good
So I
point.
think now it's time to stand, right?
Well, get off our butts and
Yes.
get some movement. So Laura's going to take us through the exercises, but we'll just do a quick little assessment here. When you stand up, best to do it without shoes if you can. But you can do it with shoes on, but preferably no shoes. But just kind of stand relaxed. Don't try to think about it too much. I know we've just been talking about posture, so it's hard not to be aware, but don't look at your feet. Just put them wherever they feel natural for you right now. If you have
Can
to even
march on the spot a little bit and just be,
uh, if you have to even close your eyes so you can just feel and not look, that's fine. But just kind of draw your attention to what you're feeling right now in the bottoms of your feet, and just notice where's the pressure. Is it the same on the right and the left, or maybe you feel heavier on one foot? You might feel more weight on the ball, the front toe area, or back on the heel. Many of you may feel something different. Maybe you feel the ball on the one foot and the heel on the other foot. That's possible. So just kind of make a mental note of that. You don't need to try to correct it right now, but this is just a simple way to assess how balanced you are, since we don't have time to take everybody's picture right now and look at it. You can just feel it instantly based on how balanced it is in your feet. And we're going to go through three simple movements here, and then we're going to test it again. And these exercises, by the way, these aren't hip exercises per se. They're actually mostly upper body exercises, but this is to show how the whole body's connected. And we're again, we're not trying to treat anyone's symptoms here. Obviously, we can't replace one-on-one exercise prescription, but this is just to give you an idea. By the way, if anything hurts, don't push through it. Just let us know. We can give you some alternatives, but we don't want this to hurt. But hopefully these are all things that we can all do together. So, all right, Laura, what's our first one?
we're going into arm circles. So let's take the golfer's grip position. If you're not familiar with that, we bend the first fingers in and the thumbs are extended wide. We stand up with our feet pointing straight ahead, 5 inches apart. From here, take the shoulder blades together in the back. So you're pulling the shoulder blades back. The arms are straight. We extend them forward to shoulder height. We're going to do forward shoulder circles. So following the thumbs forward. Let's go for 40 circles. I can let you count those. But we have a good strong rhythm. They're 6 to 8 inch circles to the front. And we keep those shoulder blades pulled together. Try to keep your shoulders down. And just notice that even through these arm circles, we are asking our shoulder blades to do some work. So what does that do? It's helping extend our upper spine, working all the spinal muscles in each segment of our upper back, middle back, lower back, and also influencing our pelvis and our hips as a result of that. Okay, so it's an indirect way of working through the hips, especially if the hips hurt. So how many of us are at 40? Anybody counted? Yes, I think Cindy did. Yep. And then release. All right. Same thing. Golfer's grip position. Take the arms, shoulder blades back together. This time, turn your palms up to the ceiling so your thumbs will be pointing back. So we follow the thumbs again. This time, circle those 6 to 8 inch circles to the back. And let's keep a good strong rhythm and keep turning those upper arm bones back. Shoulder blades are together, shoulders are down. And you might even notice a little bit of weight pressure or distribution changing in your feet. I know I do. I had a little bit more weight on my left foot before, and this is pulling me a little bit back to my right and even into my heels. So just pay attention to that, how it influences your standing position. All right, we do 40 of that. And usually we do 2 sets forward and back. But just check in again to your posture. Has anything changed already in your feet? It might be subtle, it might be not so subtle. All right, so the next ones will go through is elbow curl, Zach.
Yeah.
Okay. So same thing, we'll take the golfer's grip position. This time, take the knuckles just to the corners of your eyes or your temples, and your thumbs are pointing downwards here. So we stand up tall. I love to do this one at a wall, by the way. So if any of you have a wall space that you can bring your heels, your bum, and your back against, this teaches your body how to stay vertically aligned as we open and close the elbows. And so you'll notice if you are choosing to use a wall right now, I know for me, when I do these first 5 repetitions, my upper back wants to leave the wall, and I'll sometimes compensate by bending the wrists. So those are compensation patterns. Try to keep your wrists nice and straight. We're recommending 25 repetitions of this one
So if this
as we
is
open and close.
yeah, if so, this hurts because this a lot of work in your shoulders. So if it's too much, um, take a little rest, shake it out. If it's just a muscle burn, because you might not be used to using these muscles, that's it's not a bad thing. But if it feels like okay, I probably shouldn't be doing this, maybe some sharp pain, then best to just keep your arms at your side. You can just do some shoulder blade squeezes. Just keep your arms at your side and pull your shoulders back into the wall or
Yeah, even
stand.
shoulder rolls.
Yeah, you can just kind of squeeze and then relax and back and
Yeah,
forth.
this one is one of my go-tos. I think I have my slant board a little bit farther, but when I first get to the office during the day is doing the elbow curls on the slant board to influence the ankles and knees and the hips, and I do my elbow curls on that. That's my posture reset often when I've been sitting in the car and I come into work. That's my one go-to. That's quick and easy to do.
Yeah,
All right. Next.
overhead extension.
Overhead extension. And this can be done sitting. So you can do it sitting or standing. And if you're sitting, again, we want to roll that pelvis forward so that you're right up on those 2 sit bones with the feet pointing straight ahead. For doing it standing, feet are 5 inches apart, pointing straight ahead. Interlace the fingers, extend the arms forward, shoulders down, and then extend the arms upwards overhead. I'll let Zach time us for a minute because I'm bad at timing. And then we gently look upwards. If that feels safe for you to do, we elongate the neck and look up. So what are we doing? Taking the neck into extension, flexing those shoulders up and back, extending the upper spine.
Yeah.
We try to straighten both arms and press the palms upwards and without leaning back. So don't lean the torso forward or back. We try to stay vertical here as we extend the arms upwards.
And just go as far as your body's okay with. If it's okay if you can't reach straight up, just go as far as your shoulders will let you. Um, you might notice if you're having a hard time keeping the elbows straight, that tells us, okay, there's probably a limitation in your shoulder joint. So you can't quite get your arm up into that position. So the elbow has to bend to make it work. So, just do your best for now, but take a few more deep breaths. We're almost there. All right, that's about a minute. So bring your arms down at your side, shake it out, stay standing. Let's check in with our feet again. So now, same thing, just stand relaxed, let your arms hang at your side, take a breath, and then just notice. And you might be kind of shifting around. It's normal to have a little bit of sway, but generally, where do you feel the weight settle on your feet now? And who feels something different now than 5 minutes ago? Yeah, Susie, what changed? Oh, you're muted. You'll have to unmute yourself.
I feel a whole lot better and I'm back on my heels a little bit more.
Oh yeah, nice.
Back forward.
Perfect, cool. Christina says different. Good. Yeah,
You get a
I'll
little
go.
bit more energy. I always feel when you're sitting too long, you get kind of brain foggy and lower energy. That gets the circulation boosted, right? We're getting more blood flow to those tissues, more oxygen.
Did anyone feel at the beginning like different on their right foot compared to their left? And did that change? I'm curious. I did.
Yeah,
I had,
Christina did too.
yeah, okay. My arches. Okay. Yeah. So interesting, huh? Right. This is why I love this exercise because we didn't do anything with your feet, really. All we did was move your shoulders and your arms, and yet people are reporting like your arches are not collapsed as much, your weight's more evenly distributed. So it's
Yeah,
pretty
when we look at the myofascial system, that connective tissue links everything from head to toe. So there's an influence through the whole body.
yeah. So and that was just three, basically 3 minutes. I mean, imagine what 20 or 30 minutes would do of real corrective exercises um, based on your body. So I feel like I have all my weight on my left leg even when I don't, but after the exercises feel more even. Awesome. There you go.
Hmm.
Cool. Well, that just gives you a little taste at least. Obviously, we can get more specific because everybody's posture is a little different, so the exercise needs are going to be different. But I think in general, we can all benefit by improving our upper body posture because we all have
Yeah,
issues.
and we can choose. And that's one of the questions that we'll always ask when we meet you. Some of you have already come into the clinic, but it's first of all, how long are you willing to do? So, do I give you two exercises, three, four, five, six, seven, eight exercises? We try to keep our menus short and sweet. But also, what's the most comfortable position for you? Because we can influence our posture in a sitting position, like we did before, just practicing those pelvic tilts. And we can do postures standing. We can do them on the floor, on our backs or on our bellies in a kneeling position. So number one is it should not provoke pain. So we need to find a position and exercise for you that doesn't hurt. So we can start re-educating those muscles to restore that balance. Whether it's a few of you mentioned earlier, whether it's a tight piriformis, why is that tight? How do we restore the balance of the inner and outer and front and back hip muscles? Or maybe it's not coming from your hip. Maybe the hip is just a symptom, like Zach said. Maybe it's because the upper back is rounded or because your ankles are collapsed, that's causing some compensations and then deviations from what an aligned posture should look like. When somebody mentioned bone on bone and you wanted to avoid surgery, well, you still have over 600 muscles in your body. And although that can be very challenging, having that kind of a symptom, it's try to get your muscles as strong as possible. So we use those muscles as shock absorbers to support the joint as much as possible, so that even if you make that very personal decision to go for surgery, then you're going into it stronger and you'll recover faster
Mhm. And more balanced, right? Because you're
and
going
more
to
balanced. Yeah.
surgery with a new hip, right? But same muscles, right? Same patterns, same posture, maybe worse after, depending on how recovery goes. But so yeah, that's kind of our take on surgery is like, yeah, we want to avoid it if we can, but if you do have to have it, then let's optimize the outcomes, right? Let's get your body as straight as we can pre-surgery. When you're done, as soon as you're cleared, let's continue working on the posture so that you get the most out of that new joint, but also don't don't have issues with the other one because that's something a lot of people experience as well. They replace one hip and then the next year their other hip starts to bother them or maybe their knee or something, right? So we've got
Mm.
to make sure we're fixing the problem and not just replacing joints as they wear out, right? So well, I know we're just about out of time, so I just wanted to wrap up with some options now that you've hopefully learned some things today. We want to send you home with some ways to continue to get help. And so, really, three different options for you. I mean, you may be brand new to this and still have questions about, how does this really work and what, this may be brand new to you and you just want to learn more. Totally fine. I think the book Pain Free, that was written by our founder, Pete Egoscue. You can find it on Amazon or probably at your local bookstore or library even. Covers obviously how the method works, but there's a chapter dedicated to each body part. So there's a hip chapter, there's a back chapter, a foot, neck chapter, so it's really helpful tool. But obviously it's a book, right? So it can, you know, it can be really helpful for a lot of people, but it's not going to replace like getting some real one-on-one help with an actual human in real time. But it's a good start. Um, the second option is if you'd like some help from Laura or from me, we're happy to do a free evaluation with you. Basically, that means we'll take your pictures, whether you're come into the clinic, or we can also just do it on Zoom like this. Take your pictures, put those lines on there so you can see exactly where your shoulders and your hips and your knees and your ankles are. And that will give you a lot of really good information. Just seeing, okay, oh, that's why my hip hurts, is because look at what's going on with my posture, right? Um, so, and that's free. Doesn't include any like exercise prescription or anything, but just more to answer your questions and to give you some more information about yourself. And then, of course, if you're ready to actually make the change and start feeling better and get some help along the way, that's really what we're here for, is to give you the tools that you need, educate you, and really our whole goal is to help you learn the things so that you can take care of yourself. Just like Laura and I have been doing this for years, been able to help ourselves be pain free. That's really our goals for our client too, is to not rely on us forever. But we got to establish those good habits first, and the right training. So we kind of, how we do it is packages or bundles of either 8 or 16 sessions, typically meeting with people weekly, at least in the first couple months. So that 8-session package, you're looking at basically 2 months if we're consistently weekly. And that's usually enough time for people to really make some good progress in fixing their posture, and their pain should be significantly better by that point. 16-session package obviously gives us more time, and the price per session is a little bit less with the bigger package as well. But after your first evaluation, we can, and knowing all what's going on with you and what your goals are, then we can, put a plan together and see what makes the most sense. But those are kind of the basic options that we offer, and we're giving a 10% discount to you all for coming and participating and giving us your time. And so just make sure you let us know in the next week so that we can extend that discount to you.
Yeah, and Dorvin and Brenda also had just a quick comment there that even if those exercises that we practice today were too intense and they cause some discomfort, then yes, we have postures that are more gentle. So it's always prescribing exercises of what kind of a demand that your body is willing to take on and accept. So there are more gentle, just like there are more vigorous. So that can be tailored for sure. And if either of you want to reach out to us, we'd be happy to answer your questions on that.
Yeah, and that's part of why it's not a one and done quick fix, right? Because your body's next week is going to work a little bit differently than it did today, right? So you may not be able to do those exercises now, but maybe in the future, well, not maybe, but you will be able to do them better in the future.
Finding the right approach.
You have to progress it. So each session we're reevaluating, we take new pictures, see what got better, what didn't, see which exercises are getting easier, which ones are still hard. That'll kind of determine what the next steps are. So that's kind of what we do when we work with people. And it can be done, like I said, over Zoom if you don't live near a clinic, or you're welcome to come in to Portland, Cannon Beach, or North Seattle, where we're located. So, well, I think that, let me put our contact info there.
So the books, Brenda, how are the books different from the therapy program? There are some excellent generic menus for rebalancing the pelvis and the hip, just like the menus like Zach mentioned. We've got chapters in there for hips, for shoulders, for ankles, for feet, etc. They're usually safe exercises that most people can do. We encourage you to try them out, see how they feel. So no, because it's not the same exercises. We have over 500 exercises in our database that we could choose from based on your posture therapy. Your posture now is actually also not just read by our eyes, but also by the AI. So we've got that capability of our software in the clinics that will read your posture as well. And then we can make more targeted decisions of exercises and also try them to make sure that you feel comfortable with them. And yes, this video will be made available. Zach's going to be emailing it to you for everybody that was here today. And we want to thank you for taking the time out of your busy schedule for being with us today and appreciate all your interaction here in the chat. No, that's right, Brenda. The AI is new. Pete Egoscue have been working on that for decades, and now we have that capability of seeing posture objectives that way as well. So it's exciting for us to have that tool.